Good afternoon, everyone. We have been waiting for some minutes for others to connect. Now I think we have all the participants connected, so it's great to see such a attendance. So welcome, everyone. It is my pleasure to welcome you to one of the series of EENA's webinars. My name is Kasia Kotz. I have a pleasure to run and moderate this webinar on managing non-emergency numbers. In today's webinar, we will explore the systems of non-emergency numbers running alongside the emergency number of numbers in 3 European countries, Sweden, Austria, and Finland. So what are the benefits of having a non-emergency numbers in place? Do these help reduce saturation of emergency numbers? What is the role of each dedicated number, and how non-emergency numbers are managed? Those are just a couple of questions we will hear answers to during the next hour. I would like you to welcome our second speaker of today, Christoph Foika. Not first one, Bjorn. Bjorn will join us later. Christoph is the director of Notruf Niederösterreich of Lower Austria. During his presentation, Christoph will focus mainly on the management of non-emergency number and how these can improve the guidance and advice given to people calling the Rescue Coordination Center. Christoph, it's very nice to have you with us today. The floor is yours.
And my mic is open now and my screen is shared.
Yes, so everything works perfect.
Thank you. Welcome everybody. My name is Christoph Konstantin Kwoika, Costa Kwoika, short for Konstantin. And I'm the founder and manager of Notruf Niederösterreich. We are responsible for the biggest state in Austria. Austria has 9 states and Niederösterreich is the biggest one, surrounding the capital of Vienna. We have borders to Czechia and Slovakia, and we are very near to Hungary. And we are responsible for a lot of services. As you can see, we have more than 220 ambulance stations, nearly 100,000 firefighters here in Lower Austria, a lot of doctors we are coordinating, and right at this time we are coordinating round about a little bit more than 600 BLS resources. We are getting more than 4 million calls and contacts a year, and we are dispatching in a normal year 1.5, 1.6 million events. We are very proud that we are supporting dispatch life support to our callers in more than 3,000 cases. We are getting a lot of different numbers. So of course, if you call 112 and you have a medical emergency, you will be connected to us. But in Austria, we have still the traditional numbers: 144 for the ambulance service, 133 for police, and 122 for the fire brigade. There's also a doctor's nightline, 141, and a mountain rescue for tourists, 140. And new since 2017, the nurse triage hotline 1450, which is very important now in the COVID crisis. We are running 1 center on 4 rooms, so it's not 4 centers connected, it's 1 center and 4 rooms. Looks a little bit like this. And we are doing home office since 2017. Most of our call takers, I think all the call takers right now, because we have clustering stage 2 right now in force, they are in home office. So should only be a few dispatches in the center. The rest is at home. We are doing a lot of services for each and everybody. And some years ago, we were thinking about new visions. It is time for change, not only in Austria, but in Austria, in medical especially, because of leak of money. As you know, there has been the financial crisis in 2008, and since then, especially in the southern part of Austria, there was a big financial crisis in one state. But not only money is the problem. The problem more or less is the lack of resources. So we know exactly which doctor, which GP, which nurse will retire in the next years. And so I can tell exactly every mayor of even a small city or small village in Austria what will be the problem in 2024, 2026, or 2028. It's like the children, they are not born right now, will not go to kindergarten in 3 years and not go to their school in 6 years. So the same problems we have in the medical area, and therefore we were thinking about it, and our solution in terms of a command and control center, of a classical emergency control center, is that we are transferring from a classical dispatching center into a consulting, into a gatekeeping center. And telemedicine is becoming more and more important. To make it more clear, as in a classical command and control center, if a patient is calling with a medical emergency, you can send an ambulance or an ambulance or an ambulance. That's the only options you have. If you are in a more modern, or in German we would say in a Gesundheits, in a health command and control center, maybe you are also controlling the GP out of our service and you're responsible for patient transport. But all the other things which are possible with to solve the problem the patient or the caller has are not connected to your center. And our goal was to connect each and everybody and transfer from a classical dispatch center into a gatekeeper. So you will not hear the word gatekeeper out of the mouth of a politician. They will say it's more than a gate opener service, but it's the same. So our goal is to direct the patient to the best point of service. The patient should get what he needs, not what he wants. It may be the same, but in a lot of cases it is not the same. So after the call or during the call or during our advice, it should be clear if you need only a self service, if you can treat yourself, if you should go to general practitioners, to doctors in the field, and only the people who really need to should be directed to the hospital. And self-care instruction is a very important part of our work right now. In 10 years ago, we have been a classical dispatch center. If you call, we will come, and now we will talk to you, we will give you a lot of self-care instructions, what you can do, and where is your best point of service. What do you need for that? So we need classical, also we are using EMPDS, we are using algorithms, so it has to be clear that what we are doing on the phone is the same if I am doing it or another guy is doing it, and it has to be the same quality level and the same, at the end, the same advice if it's 3 o'clock in the morning or 5 in the afternoon, and if I'm in a good mood or in a bad mood. So you need clear algorithms, which we are using while we are using EMPDS and low code. You have to have cool web services where you can show the people where to go and give them a lot of information, and you have to do quality assurance. So we are very proud to be one of only 3 centers of excellence in the disciplines medical and nurse triage. So that is really important for us. So if a caller is calling on an emergency line, so he's getting the classical EMPDS. If he's calling on a nurse triage line, he's getting the nurse triage, and this is completely interconnected. It makes absolutely no difference where you are calling normally. So if you're, I will show it a little bit. In 2017, for marketing reasons, we established a new number, 1450, which is now Also the Corona hotline. So if you want to know anything about COVID-19, if you want to be tested, if you have symptoms, people all over Austria, they call 1450, and there they get perfect service. It's established all over Austria. There was a pilot only in Lower Austria, in Vienna, and in the most western state for Adelberg. And now it's established all over Austria and full in service. The last states connected, I think in November last year, so right before COVID started. North of Niederösterreich is doing this service for 3 states, for Lower Austria, for the state of Burgenland, and for the most southern state, Carinthia. Yeah, and as I said, every caller gets what he needs, not what he wants. So if you're calling, for example, an emergency number, 144 or 112, you will be connected to an EMD, an emergency medical dispatcher, who is able to do emergency calls. He is using AMPDS, and if it's a real emergency, the call will be immediately dispatched to an ambulance. So in Austria, we have a lot of different levels of ambulances, with a doctor, without a doctor, with paramedics, without paramedics, blah, blah, blah. So because of the decision here done by algorithms, you will get your ambulance. But if you're dialing an emergency number, and after the first questions, it's clear that it's not a medical emergency, we are not sending you an ambulance, and we are also not saying you're wrong. We are telling you, so for this, you don't need an ambulance. We transfer you to the nurse triage system, and you're connected then to an ECN, to an emergency communication nurse, which is a nurse with special skills for the telephone. And this nurse is giving you health advice and is doing a triage. And normally on the phone, on an emergency, I would say after 1 minute, we have all the information to send out the alarm, and the normal call is finished after, I think 2 minutes. Of course, we stay on the line on an emergency if it's necessary, but it's really fast to do an emergency call. On the nurse triage system, we will talk to you maybe 15 minutes, maybe 20 minutes. So it's a real health advice talk. It's not only what is your problem, I send you there. We are giving you advice what to do. And if you, for example, calling 1450 or other hotlines we are connected to, then a call taker is getting this and transferring you to the ECN, or maybe it's necessary to transfer you to an EMD. Whatever you are calling, we are triaging you to the best point of service. That's our goal. That's what we wanna reach, and that makes the system more efficient, because a lot of people who think they need an ambulance are connected then to the GP, and we tell them it's nothing you have to worry about. Go to your GP in the next 2 to 3 days. So very interesting is, do the people follow the instructions? And therefore we have data access to the Austrian insurance card system. In Austria, everybody has an e-card which you have to present everywhere where you get medical treatment. And this is only in German, I know, but it's out of the official things I can show you. And the question is, do the callers exactly do what we want them to do? Yes, they do. And it's really astonishing, because the first line says, we tell them, go to a doctor within the next 24 hours. And out of 13,000 people, 77.5%, 77.5% are doing exactly what we tell them. So they're going at the right time to the right doctor. And even if somebody is calling, for example, the emergency call, and we are telling him, oh, that's absolutely no emergency, and it's also not urgent to go to the doctor, go to the doctor within the next 14 days, 83.7% of these people are doing this, which is really astonishing because when we started this service, we thought there would be a lot of complaints because people are calling the ambulance emergency number or 112 and they expect that an ambulance shows up within minutes, and we are telling them on the phone, no, it's nothing urgent and nobody is coming. If we would like you to go to this or that doctor within the next 14 days. And at the beginning of the service, I really told our politicians that maybe there will be some complaints, maybe we will be in the newspapers, but no complaints. People are really happy that somebody is really taking the time of more than 15 minutes to help you out of what's your problem. And in the lower part, you can see that if it's an emergency, which is as quick as possible, most of the people were directed to the emergency room. But if at the end of our nurse triage there is you need doctor within 4 hours, nobody is directed to the emergency. They are directed to out of our doctor service to the GP and so on. So the system really works. And additionally, we ask the people, what would you have been doing without 1450? And it's also in German, sorry for that, but most of the people we asked said, I would walk to the hospital or I would call the ambulance. So it's really cool to have this service. And the key of success and the secret of success is that it's all in one hand. So it doesn't make a difference if you're calling 144 or the out of hours doctor service or patient transport hotlines of the Red Cross or information hotlines or complaint hotlines or 1450. You are always connected to our system, and we are deciding what where to go, where is the best point of service. Very important for us is customer service. So that was also a culture change within our comm center. The move from being a traditional law enforced comm center out to a Disney World like customer service. So we make your problem to our problem, and we are telling you exactly where to go. We're sending you all the information to your phone. You can go to your doctor. The doctor has all the information online, what we have, and we will help you in your situation. So this is how we try to reduce ambulance events in Austria, and I would say it's really successful. And during the COVID crisis, it was one of the key factors that we are not so bad at the moment. Thanks. That's it.
Thank you very much, Christoph. Now, I think we can move to the Q&A session. We have some minutes left for this. The first question I have here from the audience is the following. How the system works for non-Austrian German-speaking people, the many thousand visiting Austria?
We have translators for each and everybody. With it's the same system we are using on emergency calls. So we have translators for all the languages used in the European Union, for the main languages of the non-European, non-EU countries nearby, like Russia and so, and for the main languages like Chinese, Japanese, and so on. So you can call in any language you want. We will connect you to a translator. And our secret is that in Austria we have a lot of volunteers. As I said, we have 99,000 volunteer firemen, and we have 16,000 people in the ambulance service connected to our system. And within this big crowd, there are a lot of native speakers, and they are helping us.
Okay. If there's no other question from the audience, then I think we can now move to a second speaker of today. In this transition time, I would like to remind you all that this webinar is being recorded, and a recording of it you will be able to access tomorrow on the webinar webpage and also on EENA YouTube channel. During the presentation of our speakers, as already written in our chat, please feel free to ask your questions. Of course, sometimes there are more questions, sometimes there are less questions. You can always ask them, and we will forward them to our speakers. So now it's the turn of our originally first speaker, Bjorn, who is connecting with us by phone. Bjorn, are you with us?
Yeah, I am. I hope you hear me okay.
Yes, we do hear you well. Please, the floor is yours.
Thank you very much. Sorry for the delay. I have some technical problems, so I'm going by phone, and Kasia will show the pictures. So let's dive into it with the picture about SOS Alarm. Just some short word of the company where I work, which is the company that is managing the 112 number in Sweden, the PSAP organization. And we have we are getting nearer 50 years in the business. So, and we do operate 112. We do most of dispatching in Sweden for fire rescue services and emergency medical services, and also some other tasks like HELPLINE for missing children, and one of the numbers that are the subject for today, the non-emergency numbers in Sweden. Next picture, please. I'm not going to dive into the EU harmonized numbers. I will just show that we have 4 of the 5 that is in the 116 series. The one missing is 116117, which is actually the number for health care information, and that number is one of the non-emergency numbers. So I will not dive into this picture. You will have the PowerPoint later and can study it if you want to. So next picture, please. We have what we say 3 non-emergency numbers in Sweden. We have one for the healthcare part, and that's the healthcare guide 1177. We have a national information number 11313, and one for police non-emergency 11414. And it is these 3 numbers that I will speak more about later. We also have one website. I will touch into this also, crisisinformation.se. Next picture, please. We will start with the 1177 healthcare guide, which is where you can get the medical healthcare advice and service. Next picture, please. And we have 21 regions who are independent in Sweden, and they are the ones responsible for the healthcare, and they have joined together a service through this number 1177. And this is actually quite an old service, started in the 30s and has developed, but the number is just 7 years old, one number to cover the whole country. This is open around the hour, manned by registered nurses. You can reach it from abroad, and one important thing is the 1177 web, where you can actually, nowadays, you can fetch your test results if you have done a COVID-19 test. Next picture, please. On this number, you can get a lot of information about different diseases and treatments and so on. So, and rules and rights. This is a hub for everything connected to healthcare. Of course, if it's in an emergency, you dial 112, but this is the number for all other questions around healthcare. And as I said, we have registered nurses called advisement nurses, and they do determine the need for further care, if any. And a lot of the work is to recommend the level of care needed. So they can direct the caller to 112 if they consider an ambulance needed, but often they can give advice so you can stay at home and treat yourself. As I said, every county council or region, as they are called now, they do healthcare advisement, and they do it joint, but it is actually 21 different contracted advisement providers who do the service. They are connected in a national network, so the 1177 regional centers can cooperate. And like in the next dot, language and sign interpretation is one of these cooperation topics where they do cooperate. And last year they answered 3.9 million calls on 1177. Next picture, please. Just to touch on some of the advantages with having one number for 21 regions is, of course, that you have a quality assured system, a medical database, so you can give a unified advice wherever in Sweden you call this number. So you get a uniform advice and a quality assured, consistent advice. And the goals, of course, are to increase the access to healthcare wherever in Sweden you are, and well, contribute to improve public health. And helping the patient as we see it to the right level of care saves money for both the patient and for the society. Maybe we don't have to send an ambulance. Maybe it's okay with self-treatment at home, or you go to the hospital or on yourself, or what is necessary to handle your kind of symptoms. That was about the 1177 number, healthcare number. If we go to next slide, please. We have the non-emergency number to the police. Next slide, please. And this number was introduced in 2005. Actually, the implementation was very necessary because we have a fragmented service. There were several police stations that has their own numbers, and regions and departments and so on. So it was quite hard for the public to find the right person to speak to or the right service. And there was long waiting times in certain of these telephone queues. So now there is just one number to the police. There are no separate switchboards. It's just 114 114. And that is regardless of which person you seek, which service you need. If you want to report something to the police, of course, 112 for the urgent help. Also open around the hour. We can go to the next slide, please. There's when you dial 11414, you get a voice-guided multiple choice, so you can choose for some different kinds of services if you want to file a police report, or if you want to speak to a certain person, you can press so you get to the switchboard, and they can switch connected with the person you need to speak to. They also do, these are handled not by the police PSAPs, but from a contact center, police contact center. And they can also do witness interrogation in lesser crimes. I think they did like 1.5 million such interrogations last year and police reports. This number is also reachable from abroad and also has a web. And like the healthcare, they answered around 3.9 million calls during last year. They're actually trying to get more automated. And for example, if the citizen who calls in the automated voice message, you can, when you report what kind of business you are or you have to speak to the police about, you can get an SMS message with a link, and this gives you where to turn to in the police website. So you can do actually some kind of reporting in the website, and it doesn't have to speak to a person. If we move to the next slide, we will move to the 11313 number, which is a national number for receiving or leaving information about serious accidents or crises. Next picture, please. This is actually managed by us at SOS Alarm, but is operated by a subsidiary company, which is called UCall. It was introduced 7 years ago, and we have actually had similar numbers before. We were handling cases like swine and bird flu and blue tongue disease, the cow disease, on a mission from different authorities. But the thought about having one number is that this number should be well known to the public, so you don't have to create a number in every kind of flu or other possible event. And one of the ground purposes is to unburden the emergency number 112. So actually many calls to 112 are people wanting to asking questions about different kinds of events. And also these numbers should be close to public warning. When you hear or get a message about a public warning in your area, you can call 11313 to get more information about this. Also open 24/7, of course. Next picture, please. One important thing with the 11313 is that it only gives verified information. We don't speculate in any way, so if we don't have the information, we will tell the caller that we don't have it. But we get information now about COVID. We get much of the information from authorities' websites. If there's like a flooding, for example, we can get information from the concerned municipality or authority and so on. And this number, of course, works closely to 112. They are using the same CAD system as 112, so they can actually see events in real time. Also, this is a good number to give feedback to the authorities. We have had now in the COVID crisis feedback every Thursday together with the 1177 number, so the authorities can get information of what questions are hot right now. Are there any new questions that should be answered? Do we see any trends in the question, and so on? And as I said, the number is to unburden 112, but it has actually unburdened 1177 number, especially now. I will come to that later. Normally around 40 calls a day. Now we have around 1,200 calls. So, and one day in the 12th of March, we had actually 36,000 calls, which we of course couldn't handle. It speaks for itself. If you go to the next slide, I will just show one of the main websites that we are referring to, and that is krisinformation.se, crisis information, where you actually can, this is the information website. They are summarizing, you can read information in different kinds of languages. You can get a much good links to other authorities' websites. So you can actually find all relevant information in one place in this website. Next picture, please. Some words about the common features for the three numbers and some of the challenges. And we can go to the next slide, which shows a survey from Q3 last year. As you can see, well, the knowledge about 112 is almost everyone knows 112. Not so many knows about 11313 actually. Many more know about 1177 and 11414. But if we go to the next slide, we can see what COVID has affected these numbers. The knowledge about 11313 has gone up quite drastically during, I think, from March up to now. And if we do this survey in next year, I should expect the number to be even higher. And also 1177 has a much higher knowledge about since the COVID crisis. Next slide, please. How has COVID-19 affected these numbers? Well, actually, we have lesser incoming calls to the police, but when there was most of the calls in March, there were long waiting times on 1177 and 11313. So actually, the police got some calls about COVID, so they have automated voice message about COVID on their number also. Of course, the mostly affected is the 1177 number. So they introduced the 12th of March the forwarding possibility to touch tone dialing, press 9 if general questions about COVID, and then you get forwarded to 11313. So we have an unburdened 1177 number. And as I said, we have an enormous increase of calls. Last year we had 10,000 calls, and up to now we have over 500,000 calls during 2020. I mentioned the cooperation form, so we can go to the next slide, please. Common features. Yeah, we have, as you have noted, the numbers are starting with 11, and these are registered at the Swedish Post and Telecom Agency as numbers for important services for society in the Swedish numbering plan. So these numbers are the ones beginning with 11 is service numbers, important service numbers. You dial without an area code, and it's not for free. You have a regular call cost to these numbers. We can go to the last picture about some challenges with introducing numbers, actually, because when you introduce a number, you have to consider how to inform the public, how to implement this so the public gets known this number. And this is not so easy. We tried with the milk tetras when we introduced 11313, but then you have to keep the number well known because after a while the number gets forget about. So you have to keep it well known at all times. And we do actually get much of the help from municipalities and county administration boards. You have to have a clear message when about using the numbers and 112, when to use which number. And of course, it's important to cooperate between the bodies who run these numbers. Sometimes the questions, incoming questions, are in a gray zone between two numbers. You have to consider how to upscale, of course, a sudden increase of calls. Getting continuing info is one of the great challenges, the big challenges, to actually get the info from concerned authorities. Otherwise, these, especially the 11313, is worthless as a number if you don't get the verified information firsthand. And you have to be open to use new methods. We are looking into both artificial intelligence and chatbots right now. And last but not least, in any kind, is of course the financing of all this. And the number 11313 and 11414 is financed by the government, and 1177 by the regions, of course. That was the last slide. So thank you very much. I open for questions.
Thank you very much, Bjorn, for connecting despite the technical issues. I have one question from Christopher, who is asking if a person who is calling a non-emergency center with an emergency accident, are the non-emergency center sends information to 112?
They often, this is of course the 1177 number, the healthcare. They have a special number, a special connection, which is a 112 connection actually, so they can forward the call to us. But we don't get the data like location data. We don't get that, unfortunately. But they have a priority number, prioritized number to us at 112.
Thank you. And then maybe we could go back to the survey that you shared with us today. We see
Sure.
that 46% knew about 11313 number before COVID. So do you have any advice or recommendations about communicating these numbers to the public? Anything that you see that was successful or not successful for various numbers to make them well known? What are your thoughts about this?
Yes, start pandemic, then you get the number well known. No, actually, I think this is a work in the long term. You have to work with it and never relax. You have to keep it. I think the main sources for our information about the 11313 number is through the websites of municipalities, of regions, of authorities, so that the public can read about it wherever they go on the websites. I think that's the best way of doing it.
Okay, thank you. I will now ask if there are any other questions from the audience. If not, we're gonna move to our last presentation of
Kasia?
today. Yes?
It's Gary here, if I may ask a question.
Gary, that's why I was asking. Feel free.
Thank you, Kasia. A question to Björn. What is your estimate of the number of emergency calls that you actually do not receive thanks to these other numbers in place? Do you have any rough idea?
I should say, of course, it's never easy to understand when you don't call 112, but I should say that actually this spring, when the COVID crisis was at its most, we didn't have that much calls to 112 as expected. So I should say that I'm pretty certain that the 11313 and 1177 number did actually unburden 112 in this way.
It was clearly obvious from the COVID period, from the figures I have seen, Björn. But more outside of the COVID-19 period, would you say that they also helped release burden on the 112 service, even outside such crisis than the COVID-19?
Well, actually, there aren't so many crises. Yeah, there aren't so many crises. So, sorry, I didn't get you.
So I mean, I'm talking here mostly about 1177 and 11414, because 11313 is the crisis number. So outside of crisis time, I understand that these other numbers also help you release pressure on emergency services, on emergency lines, I mean. And do you have an idea?
Actually, it does.
Are you saving 5% of call, reducing the workload by 5-10%, something like that? You think, or
I can't. There are actually no numbers about it, but still, there we do refer like 114,000 callers, I think, last year to 11414 from the 112 number. So it is a relief in that way that you don't have to give them a number to a switchboard at a police station somewhere. You can refer them to one number, which is actually quite fast.
We lost you a little bit on the end there, Björn, but that's all right. That's okay.
Yeah, okay. I didn't get the final question if you had one.
No, it's okay, Björn. Thank you. Thank you. I'll give the floor back to Kasia.
Okay, thanks.
Okay, well then, if there are no other questions to Björn Skoglund, our second speaker today, then I will gladly move to the final presentation of today, who will be run by two speakers, Marko Nieminen, a director of ERC services, and Lisa Salminen, a senior operator of Korova REC services. They will explain what the medical helpline 116-117 is, what it is used for, and what is the service model that allows this number to work alongside the 112. So here, Marko, the floor is yours.
Thank you. Good afternoon, everyone, and greetings from Finland. I hope you are hearing me well.
Marko,
we do.
We hear you.
Okay, you can hear me. Unfortunately, no one from Digi Finland wasn't able to join this session due to ongoing busy times with COVID, and also we have autumn vacation time at the moment in Finland, so this was not the most suitable time for or them, but me and Lisa will share you information about this this topic. I'm also using a mobile device, so I can't use my camera. Lucky you. But Lisa will share her video when I pass the microphone to her. The title of our presentation is Cooperation between 112 and Medical Helpline 116-117. And I will start with general information, and Lisa will then share practical experience from the call handling point of view. Can I have the next slide, please? Yes, first of all, emergency response center services are organized nationwide within one single emergency number 112 in Finland. Emergency response center agency, state-run agency, handles about 3 million 112 calls annually, and they lead to dispatching in about 1.5 million times to different units in emergency medical services, police, rescue services, emergency social services, or border guard. We have actually two numbers for emergency cases. 112 is for emergencies in the land areas and lake areas, but there is also a special emergency number for maritime search and rescue, and that is run by border guard. But there are also many different non-emergency numbers in Finland. For example, police customer service that provides general advice with non-urgent matters on weekdays, 8 a.m. to 4 p.m. Crisis helpline is open around the clock to help people in different situations causing mental distress. Then there is poison information number that helps with the prevention and treatment of acute poisoning. There's helpline for children and young people that gives confidential support related to child welfare. Then there's a domestic violence helpline for those facing domestic violence and want to have help anonymously. We also run an on-call service of the Ministry of Foreign Affairs that gives advice in a crisis situation when you are abroad. Then there is road users hotline is for reporting issues related to traffic problems and the conditions of the road. And public service info gives advice for the users of public service, so more or less where to call or where to get the information about different authorities' services. And then there is missing child hotline is for sharing information about missing children in non-urgent cases. If it's a missing child and it's an urgent case, then it's 112 case. All of these non-urgent numbers are integrated into our mobile application 112 Suomi, and there is also info about the service or the use of the numbers. And the reason for that is that we want to have all the important numbers easily available in every citizen's pocket in their phone, so people would be more aware where to call and in different non-urgent situations instead of calling 112. That is one of the reasons, and it's working quite well at the moment. Okay, can I have the next slide? Right. In this presentation, we are focusing on medical helpline. And medical helpline is a service giving advice and guidance in matters regarding healthcare and social services. And the hospital districts organize this service. And Digi Finland Oy, which it means a state-owned company, is in charge of its development. And they are also developing digital services alongside the phone service. On medical helpline 116-117, there are registered nurses from the acute healthcare services in your region, and they will assess whether you need emergency care services or urgent care services in accordance with the regional instruction they are following. And medical helpline also gives the caller general information and guidance on health problems that may require a visit to emergency care services. And a person also can call medical helpline to get help from a professional to find out whether you should seek care outside of outside office hours. So people are advised to call medical helpline number 116 117 before going to an emergency clinic. It is also highlighted that in an emergency, call the emergency number 112 instead. So we are in between these two things. So we have a big role, and we need to have cooperation between these two numbers. So next one, please. Medical helpline started 3 years ago in the first medical district and then has developed step by step around Finland. And at the moment it covers 78% of the population. So it's about 4.3 million people in Finland. And in the future there will also be digital service available. And when establishing this new service, the main goals have been less 112 calls, less dispatches for emergency medical services, less visits to emergency clinics, less rush hours in emergency clinics, and better and more appropriate service for citizens. The last one is the number one goal, of course. The next one, please. Emergency Response Center Agency is a special authority, and we are not part of medical services, police, or rescue services. So therefore, our 112 call takers, the operators, they don't have the same possibility or authority in giving guidance in health issues as the healthcare professionals. This has meant that earlier, when there were borderline cases in which it was hard to recognize is there need for emergency medical services or not, we had no other choice than to dispatch that to EMS units, to the ambulances. But now we have approached this issue in a new way. Emergency calls related to health issues, but according to call takers, risk analysis, they're not requiring immediate response from emergency medical services and have the lowest priority classification D. They are directed to 116, 117 for further analysis. And we have a belief that almost half of the tasks can be handled with assistance via phone without the use of emergency medical services unit, ambulance. I mean, half of these D priority cases. Some calls may come back to 112 for dispatching after the analysis in medical helpline, which means that there is a need for development, especially in sharing the information between these separate systems. We are not using the same CAD system, and we are physically in separate places. So therefore, we need to have a good process how to share the information and cooperate. And next one, please. The process at the moment is that if a person calls 112 and the case is something that should be handled in medical helpline, calls are not at the moment transferred, but the caller is advised to call 116, 117 by him or herself. The reason for this is that answering times in 116, 117 may be so long that call takers can't wait in the queue to make sure the call transfer was successful. And there are also technical reasons and new features for transferring the call as a conference call are coming in our later CAD system versions. If a person calls medical helpline, but it is a possible emergency case, then the caller is advised to call 112. Then we also get the AML or other geopositioning information, and the call is routed the correct way. A nationwide patient classification criterion define when the situation is a possible emergency and the caller should be transferred to 112 for risk analysis. So this is we are using similar criterion and instructions in these two places. Next one, please. In all, it is about cooperation and collaboration between Emergency Response Center Agency 112 and Medical Helpline 116 117, and its digital services, healthcare command centers in medical districts, home services, and emergency clinics. And all is targeted for improved service and more appropriate use of resources in a country like Finland, where people are aging and the need for medical services is growing all the time. All right, this was my introduction, and I will now pass the microphone to Lisa, who will share different practical information about the cooperation.
All right, I hope you can at least hear me. Even better
Well,
if
we
you can
hear
still
you
see me.
and we see you perfectly, Lisa. Thank you for joining us.
Yeah, nice to be here. Thanks for the invitation. I can see that we only have a few minutes left, so I will try to keep it short. I've got
No, Lisa,
slides,
take your
but I've got
time.
my notes.
Take your time. We went a little bit
so-
over time with some questions and answers, but if we go over a little bit more, the topic is very interesting, so don't rush. Just, okay?
Okay. So I work as an emergency dispatcher, so I actually pick up the 112 calls, and now the last couple of years we've had this 116, 117 becoming more and more all over the country, and my personal experience is mostly positive. It's nice to have a place to refer people to if it's not an emergency, if they have maybe cut their finger or they have a bad hangover or whatever, and they need some advice from a trained medical professional. We can always give this number. That's it's free to call, and it's also easy to remember. So it's made our life a bit easier in those cases when we don't send an ambulance and we want to make them survive on their own, so they can call this number instead of us. But now, like all over Europe, the corona has created some challenges. So 116, 117, they have become really, really busy. I don't know what the situation is now, but I know that in March, April, they were not able to take all the calls that were coming to them because there was a lot of people asking a lot of questions. People wanted to get tested and so on. And this has created sort of a loop. People try to call them, they don't get through. They have to wait maybe 3-4 hours to get through, and then they hang up. What do? They call 112 because we pick up. And quite often the calls start with them saying, I couldn't get through to them, so I called you. And then in the end, the case is less urgent, and then we just have to tell them to call 116, 117 once again. So that's it's annoying to us, but it's also very annoying to the customers, I'm sure. In the beginning, when we first started this cooperation with the 116, 117, there was some confusion, I think, on both sides on how the system works, and they connected some calls to us that they were not emergency situations. Like, for instance, I can tell an example. I got a call transferred from 116, 117, and this guy, old guy, he had swallowed his false teeth, and he needed to go to the doctor to see if they could do maybe an operation to his stomach. But he was feeling fine. He was walking, and he was ready to take a taxi and go to the emergency room. And then this call was bounced back and forth. And in the end, I think he got into a taxi and went to the emergency room. But this, he called maybe 5 or 6 times during that afternoon. yeah, so there's been cases like that, but that's less and less now. I think there's they have learned how we work, and we have learned how they work more and more. Also, there's some funny confusion. Well, there has been, not so much anymore, because I speak Finnish, and the people in 116, 117, they speak Latin quite often. So they are trained medical professionals, and they use the technical terms like disease names in Latin and so on, and we don't know them. We know symptoms in basic Finnish language. How I feel now is what should happen in the future is I hope that we could also communicate better to the public on what the emergency situations are and when to call where, because otherwise the people just end up in a loop. We tell them to call 116, 117, and they tell the other way. So maybe perhaps Marco can make a note. We could maybe start a campaign together sometime in the future when there's time and money. And also one very important wish I have is that the police should also have the same kind of easy to remember, easy to get to phone numbers for asking about non-urgent matter. Because at the moment we end up doing quite a lot of police's work because they only pick up the phone Monday to Friday from 8 a.m. to 4 p.m. and any other time it's us, and we end up giving a lot of advice that should be the police's job. That's basically all that I had written down here. So I'm happy to answer if there's any questions or comments.
Okay, that was our presentation. I think there's the last slide after this. Yes.
Well, here we have your contact details, so thank you very much for sharing them with me. For anyone of you who would like to ask your questions individually after the webinar, feel free. Lisa, thank you very much for sharing with us your practical experiences, and you know, your call for action is you know, also appreciated. Now I open the floor for some questions. So far from the audience, I don't have any question. I maybe open it to Gary, if Gary has any question.
Yes, thank you, Kasia. Lisa, thank you. It was very interesting, Lisa and Marco. We will really take your points because I think they are very, it was very interesting to see from the 3 presentations with different systems, all of them using non-emergency medical numbers, but using them differently. I think, Lisa, you mentioned the need for the same number for the police, which something we should take on board at EENA as well at European level in a way. The need to have a well-defined protocol and way of functioning between 112 and 116, 117. I think you made it very clear that it's crucial, giving us very useful examples. And also we got to know, I mean, when I think about all the presentations, so sorry, it's not really a question, it's a comment, but I found it very, very interesting to see the different developments in your countries. And I really hope it will be inspiring for the audience today. I know that many countries yet do not have an emergency medical number in place, nor sometimes not, nor other non-emergency numbers. And I really believe that hearing from you was extremely useful with your practical, grounded approach as well, for really taking the calls and really knowing what you're talking about. So it was extremely useful to us, at least at EENA, I'm sure.
Thank you, Gary, for the comments.
And now we have one question coming from the audience. I think it's a general question. Are there any plans to have some common non-emergency numbers in Europe, on a European level? I leave the floor to any of panelists or Gary to answer or to follow.
I can take this one if you want me to. 116, 117 is already a recommended emergency.
You can use it in Austria. So if you're doing 116, 117, it's the same like our national 1450. So it's exactly the same. If you dial 116, 117, you are into the nurse triage.
Yes, I trust it's the same as well in Sweden. Bjorn, you're still online?
Yeah, I am. We haven't introduced the 116, 117 number yet.
Okay, so there is this recommended number at EU level, which is used in Finland and also functions in Austria. As we hear, it doesn't yet work in Sweden. There are a series of other social number or non-emergency numbers defined at EU level on the 116 range. Unless my colleagues correct me, I do not remember any police non-emergency number in the 116 list. I'm sure Benoit would quickly let me know in case there is.
No, it's not such number. No such number. It's I had it in my presentation actually. It's 5 numbers altogether: hotline for missing children, victims of crime, child helpline, and emotional helpline, and
Yeah.
of course 116, 117.
And we heard that from the audience that there seemed to be a need as well to have such number at police level, which I totally understand. And I want to say, as a private citizen living in Belgium, I felt the need to have this number, and I ended up calling the emergency number as everybody because I couldn't get through to any non-emergency police service where I live in Belgium as well. So that's something we might take on board as well within at European level.
Now I have a question more directed to the last presentation of Marco and Lisa. What helps the collaboration improve between 116 and 117 and 112? Was it just a matter of time, or were there some procedures put in place to improve this collaboration between those numbers?
Marco is here, and I can try to answer this. We started this cooperation and planning together with the Ministry of Social Affairs and Health. Maybe it was 2015 or something, and there's been a joint work group from where there is a specialist from us and specialist from medical side doing this together. And we had first a trial periods in few areas, few districts, and then we tried to find out what is the best way to broaden the service to the all around Finland. And I think the cooperation has been really smooth from the beginning, because the goals were like common. We didn't have any like a competition for resources or anything. So it's something that the medical side understood, that it's not only our problem that the people are in need of more and more advice type of help in medical issues, and they have seen this like a crucial service model to survive without creating like a big queues for ambulances on a daily basis. So this is also like a not only to improve the service, but to also survive with the resources that we have.
Okay. Thank you very much, Marco, for answering this last question. We are a little bit over time. I think that if there are no other questions to a webinar in general, to all of our speakers, then I will move to the last slide. No, we have another question. No, it was more than common that thank you very much for all your efforts. That's very nice to hear. Well, for me, the last slide is very crucial. It's about just remembering you that presentations and recording of this webinar will be available as of tomorrow afternoon on our webinar webpage and the recording on YouTube channel. If you have any questions or suggestions on our webinars, feel free to contact us. A small hint for upcoming webinar, which will be on public warning on the 10th of November. We have a series of upcoming webinars until 1st of December, so please visit our webinar page to visit them all. With all of this, I would like to thank all of our speakers today. For those who asked questions, I hope that you enjoyed our webinar, and I wish you a very good afternoon. Thank you very much, everyone.